going to get these 2 teeth crowned for you. We'll set up an appointment. It's probably be about an hour and a half. We're going to get you back just as soon as possible. Between that visit, okay, you're going to come back and get the teeth crowned. I did notice a few other things in your pictures I'd like to discuss with you if you have time. Would that be okay? We're going to need to crown these teeth. You only have 4 molars on top, 4 on top. These 2 are now needing to be crowned. This one's already been crowned. This one's probably on the list as well. I couldn't help but notice how it's only your molars that have ever had dental work. You're not very susceptible to cavities or to gum disease. All of your dental treatment has to do with wear and pressure and time. In fact, if we look at your upper teeth, hate to be the bearer of even more bad news, but those teeth are cracking also. And it won't be that much longer before they need to be crowned as well. So if we're looking at that level of treatment and that level of expense, I'd like to plan this so it would last you as long as possible, because once we get the wear and the pressure thing solved, you're not going to need me. You don't have cavities. You're just going to be seeing the hygienist every 6 months. But the cause of all this breakage, I feel, is related to how your teeth work together. Because the way God made the mouth is, when you bite together, the peak of the lower tooth should fit in the valley of the upper. That's how you crush your food. But once you bite together, when you go left and right, the teeth should glide and not rub against each other. The only way to have that protection so the teeth glide is if the canine teeth are doing their job. If the canine teeth are doing their job, when you go left and right, all your back teeth should separate. If you look at the way your canines fit together, the front of this tooth should be touching the back of this one. And it doesn't. This is closer to what we want. But because this tooth can't protect the back teeth, that's where we're seeing the breakage. In fact, you can see the wear spot on this tooth. In addition to how your teeth are fitting together, you may or may not have noticed how this tooth is a little bit toward the front. Which you know she knows that. So I always, you may or may not have noticed how this tooth is a little bit toward the front. Because it's more forward, every time you close, it hits this front tooth. And it's hitting and bouncing off that tooth. That's the reason you see like a little indent there. It's from that constant friction. If we leave the teeth in their current position, my concern is you'll have continued wear up front, and the brand new crowns we're getting ready to do won't last as long as they would have if you had a proper bite. Now, I certainly recognize the fact you probably didn't wake up this morning expecting a conversation about moving your teeth. So I don't necessarily expect you to decide today. But if this makes sense to you, is this something you'd be willing to give serious thought to? Assuming a yes, I'm glad to hear that. What I'd like to do is first answer any questions you might have about the straightening, but then also give you some information to take home, look at, maybe discuss with your husband. I mentioned that first so they can't use that as an out. I go talk to him. I'm cool with that. Go talk with your husband. I'll give you some literature. Go to Invisalign's website. Here's a DVD. When you come back to get the crowns done, if you have more questions, I'll be happy to talk to you then. But let you have time to think this through, and then let's finish this conversation. Does that sound okay? If all I get is a yes, then we're basically done until the next conversation. They say, yeah, I'll think about that, but, and then they start asking questions, then that's where we spend all of our time. Okay, but you have to give me an open door for me to really start telling you all the mechanics.